at this ASH meeting, we were able to look back at our FOL12 trial and to try to establish and to define the prognostic role of total metabolic tumor volume in the population of advanced stage, not previously treated follicular lymphoma patient. As you may recall, the FOL12 study was a study that tested the non-inferiority of a response-adapted treatment compared to a standard induction and maintenance therapy, and actually it provided indirect evidence that maintenance with rituximab was effective. So in this setting, the total metabolic tumor volume was calculated in approximately 700 patients with different methods, all confirming that the calculation of tumor volume was feasible, and confirming that the best cutoff to predict progression-free survival in this patient in this study was set as 200 ml. With the 200 ml cutoff for TMTV, it was not only possible to identify tumor volume as prognostic, but it was only possible to correlate the prognostic role of total metabolic tumor volume with additional features. And in particular, we were able to show that both total metabolic tumor volume and FLIPI-2 were both confirmed as independent prognostic factor for progression-free survival. And combining the two factors together, total metabolic tumor volume and FLIPI-2, we were able to identify 3 risk groups of patients with 30% each of the initial population. And looking at the progression-free survival, the risk groups showed a significant difference in terms of the risk of progression-free survival, with the lower risk group being represented by patients with lower TMTV and low risk FLIPI, the intermediate either high TMTV or high FLIPI, and the high risk group being that patient at both high TMTV and high FLIPI-2. And the most interesting, this model allowed us to prognosticate both patients in the standard arm, so those who received maintenance, but also in patients who were addressed to the experimental arm, that was actually patient that did not receive maintenance, and was also validated in terms of overall survival.